What is the principle behind this endovascular treatment? Your simple goal is you have to establish the flow in the normal lumen by bypassing the disease segment. This is the diseased aneurysm segment. All you have to do is establish a flow from this proximal part to the distal part. So, you place a stent in the diseased part. So, the blood goes into the normal lumen. That is your principle. For example, you are doing a stent placement in an aneurysm. Let us see what's happening. This aneurysmal part, by establishing the blood flow to the normal part, this aneurysmal part is devoid of blood supply. So, eventually it undergo thrombosis. Here you can see the now normal blood flow established. This is the principle. Basically, you are establishing a normal blood flow bypassing the diseased segment. Now coming to the route of placement through which the stents go in. The most common site is the femoral artery. It passes through the iliac artery into the aorta. That is the most commonest route of endovascular placement. Other routes include your radial artery, ulnar artery. Apart from that, in some complex procedure, you use brachial or axillary and subclavian artery too. Now coming to the procedural placement, the guide wire is placed into the vascular lumen. Then you put a sheath. Through this sheath, you place the stent. That is how you do. Okay, the stent graft is compressed in the outer sheath and with the pusher rod at the distal end. First the guide wire goes in, next the sheath goes in, and then the stent is placed via the guide wire inside the sheath, and then the sheath is removed. Here you can see the sheath along with the stent. This is the guide wire. Next, as the sheath is being withdrawn back over the pusher rod, the stent gets exposed and it opens due to the radial force of the self-expanding stent. Here it opens up, and finally you can see the stent in place, and it is usually after stent deployment and confirmation of the position, the proximal and the distal end of the graft are sealed to the aortic valve by a non-occluding endoluminal balloon. Okay, it is held in position. The stent will be placed in position. And where is the risk of endovascular procedure according to American College of Cardiology and AHA, American Heart Association? The normal endovascular procedure is intermediate risk procedure. But if the procedure is going to be complex, it is considered as high risk procedures.